The British government wants to reduce the backlog in the healthcare system, but is sticking to the lax corona policy for the time being. The number of cases is growing rapidly in the UK. Nevertheless, the government under Boris Johnson has so far strictly rejected the reintroduction of corona measures. Although there is a prepared plan B with comparatively shallow measures such as mask compulsory indoors or vaccination certificates at major events, the time has not yet come, as various ministers emphasized, and I talked to you in another video about this. The 7-day incidence in the UK was 487 on October 25th. Prime Minister Boris Johnson lifted all contact restrictions and the mask requirements for people on the island, or in England, better to say, on July 19th with the so-called Freedom Day. After a brief recovery in the number of cases, which can be seen everywhere in the summer, the incidence is now on the way up again. All of this leads to problems in the healthcare system, which, even without corona, suffers from the shortage of staff associated with Brexit. Now the British government wants to reduce the blatant backlog of treatments and operations in the healthcare system with additional investments. They say, we want to get healthcare back on track and make sure that no one has to wait for vital tests or treatments. At least Finance Minister Rishi Sunak said this, according to a statement released ahead of the budget plans from Wednesday. £6 billion, that's the equivalent of around 7.1 billion euros, are to flow into the new diagnostic centers and further increases so that significantly more examinations and treatments can take place. More than a third of the announced funds are to go to new technologies and data-supported systems in order to increase the efficiency and security of the service. The waiting lists for treatments and operations had reached new highs in the English health service during the pandemic. The Hospital Association NHS providers welcomed the announced investments, but pointed out the massive shortage of staff that would not be resolved by this. Meanwhile, hospital admissions and corona-related deaths continue to rise in the UK. They no longer achieve such high absolute numbers as at the beginning of the vaccination campaign, when more than 1,200 British people lost their lives on the virus every day. But even if the vaccination offers are now considered good, Great Britain has around 1,000 corona deaths per week to complain about or to mourn. On the island, 66.77% of the population are now considered fully vaccinated. And I'll see you in my next video. Bis gleich.